Hey there, everyone. My name is Garrett Rhodes, and I'm the product manager for emerging markets here at Redox. This presentation is called X12 Gets Lit, X12 to FHIR and Back Again. And this was a presentation I gave at HL7 FHIR DevDays back in early June in sunny Cleveland, Ohio. For those of you that had the privilege to see this presentation live, this isn't any new content. This is really just a recording for those that weren't able to see it and may want to see it. So let's get right into it. From an agenda perspective, I'll start off with a brief background on X12. Then I'll jump into an overview of X12 workflows and talk about why X12 needs to be FHIRized. And then last, we'll go through a demo of Redox converting X12 to FHIR and highlight the DaVinci prior authorization implementation guide. But first, a timeline. So to give everyone a baseline of where we've been and where we are going, let's go all the way back to 1979 when ASC X12 was formed, and ASC is the Accredited Standards Committee. And ASC originally formed X12 for transportation, government, and computer manufacturing industries. If we fast forward then 12 years to 1991, the X12 Insurance Subcommittee was created to serve the business-to-business needs in insurance or healthcare more broadly. Then 3 years after the fact, in 1994, I was born. 2 years after that, HIPAA was signed into law, which simply recommended support for an EDI standard, but didn't mandate that an EDI standard was put in place for healthcare. 4 years later, in 2000, the HIPAA translation regulation was published, ultimately adopting 9 X12 transactions for healthcare, which we'll talk about later. Fast forward then 17 years to 2017 was the day I joined Redox. Previously, I have a background in actuarial science, so the insurance industry and the intricacies of it is near and dear to my heart. Then in 2021 is really when I started as a product manager here at Redox. And also in that year, the X12 insurance message volumes exceeded over 38 billion messages, just to give people a rough scope of and size of how common X12 is in the industry. And then today, which is really back in the beginning of June of 2022, Redox launched our X12 to FHIR translation product. So you're probably thinking to yourself, why did Garrett just give me a timeline of events that included some personal events? And really, I'm here to tell you that I am by no means the X12 expert. X12 has been around far longer than I've been alive. There are probably many people in this room that represent the great Jedi Master Obi-Wan Kenobi when it comes to X12 knowledge. And those are the people that can answer all of your intricate questions around X12 and how it works and what the segments mean and why there are tildes and asterisks all over the place. I, however, am pre-episode 3 Anakin Skywalker, aka the Padawan, but without the rat tail, who may or may not turn to the dark side. That's still to be determined. So if you have questions about different X12 segments, why tildes and asterisks are all over the place, or what 95% of an X12 message means, then I would urge you to seek out the Obi-Wan Kenobis of the X12 industry. Maybe not the Anakin Skywalkers. So my goal really is to explain the use cases stemming from EDI X12, why translating it to FHIR is important, and then show how Redox can help in that process. So what exactly does X12 do in the real world? Let's put this in some layman terms that everyone can understand. And first, it's important to, again, understand that X12 does a lot of things. It's used in industries like e-commerce, transportation, government, finance, and many more. It really operates behind the scenes in our everyday lives. But as for healthcare, X12 serves a number of different purposes, which can broadly be bucketed into the insurance category. Things like requesting eligibility. So performing an eligibility check to determine what services a patient is covered for prior to a visit and getting a clear picture of that patient's financial obligation. For those X12 wonks listening to this, those are your 270 and 271 transactions. Then later on, we visit kind of the request for prior authorization workflow. And prior authorizations are used to determine for those high-cost services or medications, or I guess confirm for those high-cost services and medications with insurance that they intend on paying for those things should a doctor choose to move forward with those services or medications. It's important to note that prior authorization actually uses two different healthcare standards. The first is X12 for what are called services prior authorizations, so think surgeries. And then the second is medication prior authorizations, so high cost medications, which uses the NCPDP data standard. Redox does support NCPDP, and we'll talk about that in a little bit more detail later on once we get into the prior authorization implementation guide and demo. But really the focus of this conversation is around X12. And so the requisite X12 transactions for prior authorization are the 278 and sometimes the 275. Once that prior authorization is complete and a doctor provides some level of service, they may then generate a claim summarizing those services that were performed over the course of a visit. That claim is then sent to payers to evaluate the claim and then ultimately provide payment back to the provider and the provider organization for services rendered. Those are your X12, 837, and 835 transactions. And then at some point in the claims submission or claims management process, you may submit a claim, and at any point in time before that claim is paid, want to understand the status of a previously submitted claim. So those are your X12, 276, and 277 transactions. Again, a lot of this data is administrative data. It's kind of the underpinning of payer and provider interactions as it relates to services rendered and payment for those services. So why translate X12 to FHIR? Interestingly enough, HIPAA currently requires the use of X12 by health plans, which is a good thing. Without standards, who knows what data might exist or might not exist, or how it might be formatted, or how you might gain access to it. And so X12 is really a great thing for the industry and has been a great thing for a long time. Interestingly enough, the ONC recently had an RFI discussing some of the obstacles in X12 being mandated, given that the CMS interoperability final rule calls for provider side support for FHIR for prior authorization. And payers are just kind of left to hope that providers do in fact adopt these FHIR resources. Again, there are 38 billion X12 messages exchanged throughout the course of 2021, and I expect that number to only increase as population and encounters with the US healthcare system increases as well. So there's a lot of this data flowing back and forth between organizations, and as FHIR becomes more prominent, there needs to be some sort of bridge between legacy data standards and newer standards, thus being FHIR. And so there's kind of this saying, out with the old, in with the new, and I would flip it around and say, in with the new and out with the old, maybe. There isn't anything from a legislation standpoint, at least from my vantage point, that would appear that X12 is going away anytime soon. And so for those developers that are looking to work with FHIR, regardless of whether it's clinical data or administrative data, Redox's X12 to FHIR translation product really gives you that ability to work with FHIR on your end as a developer while still adhering to the standards that exist in the industry, such as X12. It's really the holy grail that we're shooting for, is the marriage of clinical and administrative data, all in FHIR, all in your own FHIR store. And so that brings us to kind of Redox's role in all of this. And our mission is really to make healthcare data useful. So as the various standards, not only X12, but many others off on the left-hand side, exist in the wild, Redox is a single platform that allows developers to code and develop once to Redox and our FHIR API, and Redox abstracts away the need to work with all of those various standards. So to make that a reality with the current state and massive healthcare data standards, someone must build the highways that enable builders and developers to work with any standard, but still use FHIR. So with Redox's FHIR API and deep expertise in connecting to clinical systems and translating across standards, we can make that a reality for builders. And there's a startup phrase called, often mentioned, called crossing the chasm. And what most people don't talk about is that you oftentimes need a bridge to cross a chasm. And so Redox has really built and continues to build those bridges from the current state of healthcare data exchange to a more FHIR forward future. Awesome. So let's see what this all looks like in the real world. So what you're seeing on the screen here is, and by the way, this is not PHI. So don't worry about it. This is just a picture from our dashboard that shows a sample X12 message. And you can tell right away that this is a pretty messy standard. It's not exactly visually appealing. But let's decode some of that, starting with what I've underlined in red here. So if we start at the top, we see this ST asterisk 278 asterisk 1235. And this tells us that this is a transaction set segment as denoted by the ST, which represents an X12 278 message, hence the 278, and that this is the 1,235th prior authorization generated from this system or received from this system. Looking towards the bottom, everything underlined in red essentially translates to the following: a request to transport a patient, which is in fact a professional service, for a specified date and time, where the patient needs 80 units of hyperbaric oxygen therapy. Oh, and there is some additional information to support the request in the form of fax with a control number. And then everything at the end, right here, is a trailer closing out the transaction by once again confirming that this is the 1,235th prior authorization. So that's a lot, and it took me quite a while, actually. I did this on the plane ride to Cleveland from Denver, pulled up the X12 278 spec and guide, and attempted to decode this message. And everything you see in red is what I was able to decode in the course of an hour and a half. So there's more information in this message, but just to give you a highlight of how messy this standard is and how challenging it might be to work with. So let's see what Redox does. So I unfortunately wasn't able to take that entire message and put it into a slide that was then easily viewable and everyone could read. So I took just snippets of it to show, to kind of show how Redox maps that X12 format that you saw on the previous slide to a FHIR resource here on this current slide. And so what you're seeing with these red arrows is a HCPCS code denoting hyperbaric oxygen therapy, and then a quantity of 80, which is pretty self-explanatory, much more human readable. And then everything at the bottom here is again calling out that this is the 1,235th prior authorization from the system, all of your kind of trailer transactions. So I think we can all agree that this is much more visually appealing. I think what we saw on the last slide is not exactly very human friendly. And so this FHIR format makes it a lot easier, not only for humans to read, but also then to process from an application standpoint. So let's put this into a little bit more context as well by looking at Redox's FHIR prior auth API. On the screen is a series of boxes and lines showing said API based on the DaVinci prior authorization support implementation guide. And for those that aren't aware, DaVinci is a work group within HL7 between payers and providers to take what comes from the regulatory landscape and legislation and actually implement it, and figure out how it gets implemented between all of the relevant parties in that transaction. And so what you're seeing on the screen is actually a flipped version of the DaVinci prior authorization support guide. So off on the left-hand side there, you see X12 transactions leaving a provider organization or what might be a provider organization in their EHR, going through Redox, and then being translated to FHIR resources that then get pushed to a healthcare technology solution. That healthcare technology solution might be a digital health company. It might be a homegrown solution that a payer uses. It might be a homegrown solution that a provider uses. So really, you can interpret this diagram as the current state or flipped. It really depends on your role in this process and whether or not you have an appetite to work with FHIR or not work with FHIR, work with X12 or not work with X12. So all of this is bi-directional. So to highlight or to kind of walk through this diagram, we're actually going to start in the middle at the X12-278 request transaction. So that transaction would leave a provider organization. Redox would map that X12-278 request for prior authorization to our claim $submit FHIR resource and operation, which we then push along to the healthcare technology solution. As part of that request, there may be some additional documentation, things like a CCD, patient notes, any number of different things used as justification or supporting information when reviewing that prior authorization. That's denoted in the X12-275 transaction, which Redox then maps to claim $attach. Then, as this healthcare technology solution or payer or provider, whoever it might be on the receiving side of this, receives the prior authorization and all the supporting information, they then import it into their utilization management tool or any other process on their end to evaluate that prior authorization and generate a response. And so they would send that response to Redox as claim response $respond, at which point we would map that to the X12-278 response message to send into the receiving organization. So let's jump into the Redox developer dashboard to see how you could do this all today for free. So the first step is navigating to dashboard.redoxengine.com and creating a free account. Once within your account, you can go over to the developer tab to get started. You'll need to connect your application to Redox to actually receive the output, but I'll skip that part for now. Once you select your endpoint, you'll then want to click on DevTools here at the top by the number 2. At step 3, then you'll be able to select your data model. And you'll see here that in this dropdown, you go to FHIR.claim $submit, and then we're going to select that FHIR claim submit operation or resource in operation. Then here, so it shows here we've submitted that FHIR claim $submit resource in operation. You'll see here then in the developer dashboard or in the dev tools that there's an option to select either the procedure prior authorization request or a medication prior authorization request. So again, as I said earlier, Redox supports, through our prior auth API, Redox supports both the services prior authorization, which are legacy X12 transactions, as well as the medication prior authorization, which are legacy NCPDP transactions. And we bundle those or the support for both of those in our single FHIR API. So you'll see here we've selected the procedure prior authorization request. You can see a sample output here. And then at step 3, we're going to hit send data model. Right when we hit submit, then we get a notification as to whether or not we were successful, along with a log ID. In the below image, we can go over to the Redox logs dashboard, which serves as a QA and test environment for users. And then in step 3 here, we can actually click into the message that we submitted. Again, I drafted up all of these slides back at the beginning of June, so these are old, but we could click into that message and actually see the contents of the message and the fact that the process was successful in each one of the steps. And remember, always do your prior authorizations. or else you'll end up like Darth Vader. And no one wants to end up like Darth Vader. And that's it. Thanks for joining. Thanks for listening along. We're really excited to launch this new X12 FHIR product. There's been a lot of initial customer demand, and we're seeing continued demand from our customer base and new customers as well. So if you're interested, feel free to contact me at garrett@redoxengine.com, or talk with your Redox representative, or reach out to us on our website at www.redoxengine.com. Thanks again for listening, and have a great rest of your day. Bye.